Have you ever contemplated what truly occurs behind the scenes in nursing homes? We frequently acknowledge the assistance and guidance they offer. However, what often goes unnoticed is that there exists an alternative perspective to the narrative. A topic that often goes unnoticed. Some facilities provide exceptional care, yet others may have underlying problems that could impact the health, safety, and overall well-being of the residents. And the most challenging aspect, families may not always be aware of these issues until the moment has passed. This video reveals 6 crucial aspects of nursing homes that are often overlooked and deserve attention. Addressing issues such as chronic understaffing, undisclosed fees, mistreatment, and medical neglect is crucial for improvement. These issues can transform what ought to be a nurturing environment into a source of distress. By the end of this video, you will be equipped to identify warning signs, pose insightful questions, and protect yourself and your loved ones from these concealed threats. Join me on this journey until we reach the conclusion. One of the most frequently neglected matters impacts nearly every resident, yet it remains largely unspoken until it reaches a critical point. This is an opportunity you definitely want to seize. Let's begin our journey. Firstly, insufficient staffing results in oversight. A significant and concerning issue in nursing homes is the persistent problem of chronic understaffing. A significant number of facilities are facing challenges due to insufficient caregivers to adequately support all residents when team members are overextended. It is the residents who bear the brunt of the impact. How does this manifest in practice? Are meals being missed, medications delayed, call buttons unanswered, and seniors left in soiled clothes for extended periods? It's not that caregivers lack concern. The issue arises from a lack of sufficient manpower to complete the tasks at hand. Consequently, those who require assistance frequently find themselves without the support they need at critical moments. When nursing home staff experience high levels of workload, even fundamental needs can be overlooked. Inadequate repositioning of residents in their beds can result in the development of painful bed sores. Individuals requiring support with their eating may not receive the necessary assistance, potentially leading to malnutrition or dehydration in certain instances. Essential medications may not be administered promptly or may be entirely overlooked, resulting in significant health complications. Neglecting this aspect can lead to a swift deterioration in well-being. For numerous families, the changes unfold so subtly that they remain unaware of the situation until it reaches a critical point. Consider the situation of Walter, an 82-year-old gentleman, whose family chose to place him in a facility they thought was highly regarded. Initially, all appeared to be in order. However, as time passed, his daughter began to sense that something was amiss. With each visit, it became increasingly apparent that he was growing more fragile, bewildered, and lost in his surroundings. Only when she began to inquire did she uncover the reality. The staff had overlooked his medications on several occasions due to their overwhelming workload. He had shed some pounds, as there was no one ensuring he had his meals. Additionally, he experienced discomfort due to the development of painful sores from remaining in the same position for an extended period. The family placed their trust in the facility for his care. However, due to a lack of adequate staffing, he was allowed to decline. This issue is not only exasperating, but it also poses significant risks. Research indicates that nursing homes characterized by low staff-to-resident ratios experience elevated rates of falls, infections, and hospitalizations. Insufficient caregivers lead to a lack of regular check-ins for residents, resulting in medical emergencies potentially going unnoticed for extended periods. For seniors, each moment is invaluable. What steps can you take if you or someone close to you is contemplating a nursing home? Examining staffing levels should be among your initial priorities. Inquire about the number of caregivers assigned to each resident, both during daytime hours and overnight. Make visits at various times to assess the response speed of call buttons. When team members appear hurried, overwhelmed, or unable to offer prompt support, it signals a significant concern. When a facility operates with insufficient staffing, neglect becomes not just a possibility, but an unavoidable reality. In reality, neglect is just one of several important issues at hand. Secondly, inadequate hygiene and unsanitary environments. A nursing home should evoke the expectation of a clean and well-maintained environment. Ultimately, these facilities hold a crucial responsibility for ensuring the health and safety of their vulnerable residents. However, the truth is that numerous nursing homes face challenges in upholding adequate hygiene standards, and the repercussions can be severe. Soiled floors, neglected linens, unpleasant smells, and potential pest infestations. These are merely a few of the challenges that families often uncover when it's already too late. For seniors with compromised immune systems, inadequate sanitation poses not only discomfort but also significant risks to their health. Infections proliferate swiftly in unsanitary settings. Individuals who remain in soiled clothing or unchanged diapers face an elevated risk of urinary tract infections and uncomfortable skin conditions when not properly sanitized. Shared equipment like wheelchairs or medical devices can become breeding grounds for bacteria. A seemingly minor oversight, such as a caregiver neglecting to wash their hands, can trigger significant outbreaks of illnesses, including pneumonia or gastrointestinal infections. In severe instances, poor sanitation has resulted in extensive disease outbreaks, increased hospitalizations, and even avoidable fatalities. Consider the situation of Eleanor, a 79-year-old woman who transitioned to a nursing home for short-term rehabilitation following a fall. Her family made frequent visits and observed a lingering smell in the hallways, yet the staff reassured them that it was not a cause for concern. In a matter of weeks, Eleanor experienced a significant respiratory infection. What is the reason behind this? Neglected ventilation systems that have been left unmonitored for years. Once the issue came to light, several residents had already fallen ill, leading to Eleanor's hospitalization. What her family believed to be a secure environment had, in reality, subjected her to avoidable health hazards. Indicators of inadequate hygiene may not be immediately apparent. A facility might appear polished during a planned visit, yet the reality behind the scenes can tell a different tale. When contemplating a nursing home for yourself or a loved one, it's crucial to focus on the finer details. Are the floors and bathrooms maintained in a clean condition? Are the hallways emitting a fresh scent? Is there an enduring scent of urine present? Are residents presenting themselves in a tidy manner with clean attire and well-combed hair? An effectively managed facility will implement rigorous cleaning protocols and ensure adequate staffing to uphold them. Cleanliness transcends mere comfort. It revolves around well-being and respect. It is essential for residents to inhabit a setting that fosters their well-being, rather than one that jeopardizes their safety. While unsanitary conditions present significant concerns, the subsequent issue we will address is even more alarming. This is a situation that occurs far too frequently in private, and unfortunately, many families remain unaware until it is too late. If you're still engaged with this video and appreciating these insights, kindly comment with the number below to indicate your presence. If you haven't subscribed yet, I highly encourage you to do so and activate the notification bell to stay updated with all our videos. Your support empowers us to keep producing valuable content that informs and inspires you. Let's proceed to the next step: Thirdly, we address emotional and physical abuse. It is truly disheartening to acknowledge that within nursing homes, some residents endure emotional and physical mistreatment from those who are meant to provide them with care and support. It's a scenario that no family wishes to contemplate. Yet instances of verbal insults, neglect, and blatant abuse persistently emerge year after year. Due to the cognitive impairments or challenges in communication that many seniors face, these incidents frequently remain unreported for an extended period. Emotional abuse often manifests in nuanced ways, yet its impact can be profoundly harmful. It involves staff members overlooking residents, addressing them in a harsh manner, or creating a sense of burden for them. Envision a scenario where you rely entirely on another person for your everyday necessities, yet are met with impatience, frustration, or even harshness in return over time. This type of treatment can result in feelings of depression, anxiety, and a profound sense of isolation. Certain residents cease their consumption of food, some individuals pull back, becoming disengaged from pursuits that previously brought them joy. In the most severe situations, individuals may ultimately surrender to despair. However, emotional mistreatment is not the sole issue at hand. Physical abuse occurs more frequently than many individuals understand at times. Caregivers who are feeling overwhelmed by stress or frustration may inadvertently direct their feelings towards residents. Some individuals exploit the vulnerability of seniors who cannot protect themselves, employing excessive force during care or neglecting them by leaving them in bed for extended periods as a form of punishment. Additionally, we must address the concern of aggression among residents. Without adequate oversight, conflicts have the potential to intensify into physical confrontations, leaving at risk seniors susceptible to harm without intervention from those who could safeguard them. Consider the situation of Harold, an 81-year-old gentleman who transitioned to a nursing home following a decline in his mobility. His family observed bruises on his arms, yet when they inquired about them, the staff dismissed it as a trivial incident. As time passed, Harold increasingly retreated into himself, becoming more apprehensive and anxious. A visiting relative discovered the truth when they overheard a staff member addressing him in a degrading manner. He had been treated poorly by caregivers who viewed him as an inconvenience, rather than as an individual worthy of dignity and respect. His family had placed their trust in the facility for his care, yet he found himself engulfed in fear instead. What strategies can you implement to ensure the safety of yourself or a loved one? Staying alert is essential. A sudden change in a resident's behavior, such as becoming withdrawn, exhibiting fear, or avoiding discussions about their experiences, may indicate a potential concern. It is crucial to pay attention to frequent, unexplainable bruises, bed sores, or sudden weight loss, as these signs should never be overlooked, and above all, make your visits at unforeseen moments. Misconduct frequently occurs when employees feel they are not being observed. Consistently being present and posing straightforward inquiries conveys a powerful message: your loved one is not isolated. Everyone has the right to feel safe in an environment that is meant to offer support and healing, despite advancements. Abuse continues to be one of the most troubling aspects of the nursing home system. While this situation is concerning, the forthcoming topic we will address poses an equally significant risk, with repercussions that extend beyond mere physical or emotional harm. It's a financial issue, and more families are uncovering it through challenging experiences. Fourthly, we must address the issue of concealed charges and the potential for financial exploitation. Numerous families hold the belief that after selecting a nursing home and finalizing a payment plan, they have a clear understanding of what lies ahead. However, Many individuals remain unaware that hidden fees, misleading contracts, and even blatant financial exploitation are more prevalent than they might assume. For many individuals, the initial expense of care may seem reasonable, but it can unexpectedly escalate over time due to unclear fees. Many find themselves in the unfortunate position of realizing too late that their loved one's financial resources have been exploited through misleading tactics, resulting in a complete loss at the time they need support the most. A prevalent financial pitfall often arises from ambiguous or deceptive contracts. Families frequently enter into agreements that appear straightforward initially, only to encounter unexpected fees for additional care that ought to have been part of the original arrangement. Basic services, such as aiding a resident in getting dressed, accompanying them to meals, or providing mobility assistance, can be itemized as distinct charges, potentially increasing the monthly bill by hundreds or even thousands of dollars in certain situations. Families become aware of the circumstances only after receiving bills for months of services they never consented to. However, that is not the sole issue at hand. Certain nursing homes have been found exploiting residents, particularly those with cognitive impairments who may lack a complete understanding of their financial circumstances. Some facilities have been reported to exploit seniors, persuading them to relinquish control of their bank accounts, pensions, or property. In the most troubling instances, employees have been discovered falsifying signatures, modifying financial records, or coercing residents into financial choices that ultimately jeopardize their stability and well-being. Take into account the situation of Barbara, an 84-year-old woman who has spent the last 2 years residing in a nursing home. Her family meticulously planned their finances for her care, ensuring she had sufficient resources to meet her needs. One day, her daughter observed that Barbara's savings account was nearly empty. Perplexed, she sought out the financial records and uncovered that Barbara had been charged for services that were never rendered. Unattended physical therapy sessions, unnecessary medication refills, and a lengthy array of unexplained administrative charges. Upon addressing the nursing home, they asserted that everything was above board. Upon deeper examination, it became evident that Barbara had been consistently overcharged for an extended period. What strategies can you employ to safeguard yourself or a loved one against financial exploitation? Initially, it is essential to ask for a comprehensive breakdown of charges and examine them thoroughly. If you encounter a bill that appears excessively high, feel empowered to seek clarification. Secondly, refrain from signing any documents unless you have a complete understanding of their content. When encountering ambiguous phrases in a contract, such as additional services may apply, it is essential to seek written clarification. Additionally, it is crucial to ensure that a reliable family member or legal guardian is actively overseeing the finances of residents with cognitive impairments. This oversight is essential to safeguard against unauthorized withdrawals or unforeseen alterations. Financial exploitation represents a profoundly troubling aspect of nursing homes, as it robs individuals not only of their financial resources, but also of their sense of security, independence, and peace of mind. This situation is concerning, and the next topic we will address is equally significant. It represents a critical factor that can significantly impact outcomes, yet numerous nursing homes do not manage it effectively. If you're still engaged with this video and appreciating these insights, kindly comment number 4 below to indicate your presence. If you haven't subscribed yet, I highly encourage you to do so and activate the notification bell to ensure you stay updated with all the latest videos. Your support empowers us to keep producing valuable content that informs and inspires you. Let us proceed onward. Fifth, there is restricted medical supervision. Numerous nursing homes promote themselves as facilities providing adequate medical oversight, yet the actual experience frequently diverges significantly from the expectations of families. In numerous instances, older adults face significant delays in obtaining medical care, are given unwarranted medications to maintain sedation, or have their health issues overlooked until it becomes critical. In the absence of adequate medical oversight, even seemingly minor health concerns can rapidly develop into critical emergencies. A significant challenge we face is the insufficient presence of medical professionals on site. In certain high-quality nursing homes, dedicated doctors or skilled nurses are consistently available, ensuring that residents receive the care they require. Conversely, some facilities rely on part-time medical staff who visit infrequently, which can result in inadequate support for residents during critical times. In the event that a resident unexpectedly falls ill or suffers from intense pain, there may be a significant delay, potentially lasting hours or even days, before they receive the necessary medical care. For seniors facing chronic conditions, such as diabetes, heart disease, or dementia, this delay poses significant risks. A significant concern is the excessive reliance on medication, especially sedatives and antipsychotic drugs. Certain nursing homes opt for medication as a means to control resident behavior instead of focusing on their genuine needs, rather than offering tailored care. Staff might resort to administering strong medications to ensure residents remain calm and compliant, even when such actions aren't warranted from a medical standpoint. This approach, often known as chemical restraint, may result in severe side effects such as confusion, falls, and a notable decline in quality of life. Consider the situation of Gerald, a 77-year-old individual who had consistently demonstrated mental acuity prior to his relocation to a nursing home. In just a few months, his family observed a significant transformation. He appeared dazed, bewildered, and out of sorts, finding it difficult to engage in conversations he previously relished. He was worried that his daughter had reviewed his medical records and was taken aback to discover that he had been prescribed strong sedatives, medications he had never required in the past. Upon addressing the staff, she discovered that the medications were administered to alleviate his restlessness instead of addressing any genuine medical issue. He had received excessive medication, not for his well-being, but rather for the ease of the facility. When considering the care of yourself or a loved one in a nursing home, it is essential to inquire about the critical aspects of medical oversight. Is there a physician available on the team, and what is the frequency of their visits? What is the process for prescribing medications, and who determines when adjustments are necessary? In the event that a resident falls ill, what is the time frame for them to access medical assistance? These inquiries can uncover significant insights into the genuine quality of care a facility offers. Medical oversight encompasses more than merely addressing current health issues. It's essential to ensure that residents obtain the care they need promptly, preventing minor issues from escalating into critical emergencies. This issue is undeniably serious. Yet the last concern we must address is often overlooked by many. This is an issue that impacts almost every resident, yet it often goes unspoken until the consequences are already evident. One of the most underestimated challenges in nursing homes isn't related to medical neglect or financial exploitation. The impact of loneliness and isolation on one's emotional well-being is profound. Numerous seniors arrive at a nursing home with the hope of experiencing a vibrant community. Yet they often discover themselves isolated for extended periods, lacking significant engagement. As time progresses, this sense of isolation can evolve into depression, impacting both mental and physical well-being, the most challenging aspect. Numerous families remain unaware of the situation until they notice that their loved one has already distanced themselves. For seniors, fostering social connections holds equal significance to receiving medical care. Research indicates that social isolation among older adults can elevate the likelihood of developing dementia, compromise immune function, and potentially reduce life expectancy. In numerous nursing homes, it is common for residents to find themselves largely confined to their rooms, often gazing at the walls or watching television in solitude. Team members frequently find themselves overwhelmed, leading to a lack of participation in valuable discussions and organized activities, which, when they do occur, often suffer from low attendance or fail to capture interest. The outcome: a profound feeling of isolation from the world, causing numerous seniors to disengage from life altogether. Reflect on the situation of Helen, an 80-year-old woman who transitioned to a nursing home following the loss of her husband. Initially, she focused on maintaining an optimistic outlook, aspiring to forge new friendships and engage herself in various activities. However, over time, she observed that the staff were consistently hurrying from one task to the next, and the other residents seldom engaged in conversation with one another. The social events failed to offer variety, creativity, and meaningful interaction. Soon, Helen ceased her efforts. She dined in solitude, spent the majority of her day enveloped in quietude, and when her family came to visit, they observed that the spark in her eyes had faded. She wasn't ill, yet she was enduring hardship. It is concerning that numerous nursing homes overlook the emotional needs of their residents. They prioritize the provision of food, medications, and essential care, yet overlook the fundamental human requirement for companionship. For seniors without regular family visits, the impact of isolation can be profoundly challenging. What strategies can be implemented to avoid this situation? Prioritize social engagement if you or a loved one resides in a nursing home. Inquire about organized activities, communal outings, and avenues for residents to cultivate authentic connections. Encourage consistent communication through regular phone calls, video chats, and visits from friends and family if your loved one is already in a facility. Even a seemingly straightforward action like bringing in a companion for a few hours each week can create significant positive change. Loneliness can be a quiet battle, yet it is not a fate we must accept. Nursing homes ought to embody environments of compassion and community, rather than solitude and hopelessness. Having explored these 6 darker aspects, it's important to pause and consider the insights we've gained and the actions we can implement to enhance our decision-making for ourselves and those we care about. If you're still engaged with this video and appreciating the insights shared, kindly comment number 6 below to indicate your presence. If you haven't subscribed yet, I highly encourage you to do so and activate the notification bell to ensure you stay updated with all the latest videos. Your support enables us to keep producing valuable content that informs and inspires you. Let us proceed onward. Concluding reflections. Shortly known as Ray Huntsman, we have identified 6 critical truths about nursing homes, challenges that far too many families come to understand only when it's too late. The issues of understaffing, unsanitary conditions, financial exploitation, and emotional neglect are critical challenges that profoundly affect the lives of seniors who truly deserve much better care and support. It's important to acknowledge that although certain nursing homes excel in providing quality care, numerous facilities exhibit significant shortcomings that may jeopardize the well-being of their residents. As caring individuals, we have the responsibility to inquire thoughtfully, observe attentively, and support those who might struggle to voice their needs. When contemplating a nursing home for yourself or a loved one. It's essential to look beyond the brochures and the assurances provided by the facility. Engage directly by visiting, conversing with the staff, observing the treatment of residents, and reviewing feedback from other families. Inquire about the level of medical oversight, the ratios of staff to residents, and the opportunities available for daily engagement. It is crucial to remember that an appealing and polished exterior of a facility does not guarantee that it is providing the essential care that seniors require. Nursing homes must embody dignity, care, and respect. They should never become environments where individuals are overlooked. If today's video has prompted you to reconsider the realities that unfold behind closed doors, then it has successfully fulfilled its purpose. Understanding is the initial move towards making improved decisions for yourself and those you care about. We appreciate your presence with us today. We eagerly await your insights. We invite you to contribute your thoughts in the comments section. Please share one insight you gained today and describe how you intend to apply it in your life. Your insights hold great value, so please feel free to express them. Your feedback inspires and uplifts us tremendously. If you found this video valuable and enjoyable, consider liking, subscribing, and sharing it with others. Your support empowers us to keep producing valuable content that informs and inspires you. We appreciate your viewership and eagerly anticipate your presence in our upcoming video.